Hello, friends. Welcome to all of you for our second case of integrated homeopathy. Today, we have one of our most dynamic speakers with a dynamics case. So let's all inspire, enhance, and improve together. Welcome, Dr. Anita Bajaj, with your dynamic case.
Good evening, everyone. I'm Dr. Anita. I'll be presenting a case of paranoid schizophrenia today. So let us start with the case description. Shobha, please share the PPT.
Yes. Yes, Anita.
So this is the case of a lady whose husband, brother-in-laws, sister-in-law are under my treatment from long time. And this lady also had come to me many years back for blood pressure and headache. But that time she took treatment only for 2-3 weeks and she just dropped out. And now after few years, she was brought by her husband. Husband-wife relationship is not very good. So she doesn't listen to her husband that way. But this time the complaints were more. So she agreed to come to me for the treatment. So this is how she presented.
Yes, Anita, can you see?
Case of she presented with anxiety, fear, palpitations, sleeplessness, acidity, gases, appetite increased for rice and spicy. Then thoughts, lot of thoughts she used to get. And I knew from her husband's and brother-in-law, sister-in-law's cases that she was having a lot of issues and she was quite suspicious about her husband having an affair with youngest sister-in-law. So I knew this background, and now she is talking about all these complaints. She felt neglected by her husband, who doesn't give money for my child and my own basic needs. Like she said, for my daughter's sanitary pads also, I have to spend from my pocket. So for that, she does some odd jobs, like some sticking diamonds on bindi and all those small jobs. That type of work she does, and she earns little money to meet with her own needs and her children's needs. And she and her husband don't have physical relations from last 5 to 6 years. And if she forces him, he shames her. You only want this, like you only want physical relations and you don't care for other things. So she used to feel ashamed. Then this husband, she feels that husband has affair with youngest sister-in-law, and he rushes to attend to all her needs. Whenever she is sick or whenever she needs any help, her husband goes there, and for patient's needs, he is not there. And she says that my children have seen them doing dirty job, and most of the times both of them are online same time. So she suspects that they are chatting with each other. And sister-in-law stays with her parents in adjacent room. So actually the sister-in-law from her childhood days used to visit their house, and she used to help them in household chores and all that. She's from a poor family. So this patient's husband used to help her financially for her education and all that. Her husband actually considers her like a daughter, and whenever he gets some things, eatables or anything, or Diwali sweets for his own children, he gets those things for her also, considering her as a daughter. And then patient's brother-in-law fell in love with her, and they decided to get them married. So patient's husband also felt that if she is educated, she will take care of my family. She will, help me in the business. So he started credit society and helped her get educated in commerce background so that she will help him in the credit society work. So this is how patient's husband and sister-in-law are in contact with each other because of work and because of this type of relationship. Now, sister-in-law stays with her parents in adjacent room. So patient feels that they are doing some black magic, burying things near my house like lemon and all that, whatever some, spiritual healers give them. And they give my husband non-veg. Now, this lady believes in Devi. So they don't eat non-veg at their house. So she feels in her absence, they feed him non-veg. Because of that, he remains away from me. He doesn't come close to me. And whenever they are passing by, they peep into my house. Then sister-in-law's father sends mullahs because their area is like Muslim and UPites are, the majority is that. So she feels that he sends mullahs after me and they do dirty work with me. See, this is patient's delusion. So please don't, I'm very sorry if anybody's religious sentiments are hurt by using these words. So she feels that way, and she not just doing it is not just a delusion, but she actually feels that she gets pain in her thighs, she gets weakness and leukorrhea, like how one gets after sexual relations. Shobha, next.
Yeah, just a minute.
So she feels they do black magic on my children too. And because of that, elder daughter is always sickly. And other daughter also complains of weird things. Now this lady has 3 daughters and 1 son. Patient hates her husband as he cares more for sister-in-law and fights with patient. Patient doesn't like his sight also. So whenever he comes home, she goes out and sits outside her house and chats with the neighbors. She likes to sit out and gossip with neighbors. And because house is also small, chores are congested. So sitting out, she feels better. At home, she feels suffocated. She also suspected her sister-in-law's brother of having stolen her mobile. Now, I have not confirmed the truth behind this incident, but what she told me that he had once stolen her mobile, and she found out because he had sold that mobile in the nearby shop only. So there was a fight, police complaint also was done, and police took him away. And because of that, sister-in-law and her mother, they threatened her that we will bury you all alive. And we will see how you stay in Mumbai. So this is what patient has said. Otherwise, patient's sister-in-law is also my patient, and she's quite educated and a sober lady, and she attends to all families' needs. So whenever patient also goes to native place, she comes to her house and cooks for her husband and children and does all the work. So she most probably, according to me, she is Ignatia or Carcinosin type. And her parents too are very simple and poor people. But this lady has all these feelings. So according to husband, patient herself is a selfish, dominating and stubborn lady. And she has her own way generally. She has never cared for whole family as an eldest daughter-in-law. Whereas husband is always husband always cares for everyone in the family, and he thinks of the whole family. He is concerned about the whole family, all brothers, sister, and parents. Whereas this lady never even visited her mother-in-law when she was here in Mumbai for her cataract surgery, and she was staying next door in her other sister-in-law's house. And even when this youngest sister-in-law with whom she suspects her husband's relations, she was sick and she had aborted. So patient never felt sympathetic for her, didn't visit her. And on the contrary, she, accused that she had aborted because the child was her sister-in-law's and her husband's, like patient's husband's. she would always insist on going to native place after the vacation is over. So she is not, concerned about her children's studies also. And all this is going on from last 5 to 6 years. And because of all this stress, husband also has developed diabetes. He had erectile dysfunction and would avoid sex, and patient threatened him of going to others for her needs. She was sexually very dissatisfied. She probably had affair with someone that husband had, seen some chats on her mobile. So he also suspected that she has some relation with somebody. Now, patient is also talks of being Devi Bhakt, saying that my goddess will protect me. And she also, has taken a vow that till this problem doesn't get sorted out, I will not dress up like Suhagan. I will not do Suhagan ka Shringar like a married woman. She also approaches a spiritual healer in village. She calls him up from here and he does some rituals there. And she believes it helps her. She has shelled out a lot of money for that and even sold her jewelry for paying for that, because husband tells her not to fall for all these things and take proper psychiatric treatment. Sister-in-law also being educated, she also suggested her husband that he should take her to a good psychiatrist. So she feels that these people will prove that I am mad and send me to mental hospital. Like once her sister-in-law's mother was affected psychologically, and she was taken for treatment to a nearby BMC hospital. Now, this time she came in a very desperate state. She was quite fearful, anxious, and lost. Next. So now, what do you think about the clinical diagnosis? See, in this case, because of the suspicions and all that, paranoia is very clear that people are trying to harm her. People are doing things which can harm her. Her insight is lost. She feels that she is right and others are wrong. And she believes in her delusions to the extent that she feels all the sensations. She talks of dirty work means sex, and suffering from the experience at sensory levels means they are hallucinations. So considering this, it is a case of paranoid schizophrenia. As DD, paranoid personality disorder comes up, but in paranoid personality disorder, there are no hallucinations. So this is the case. Shobha, stop share. Now, Shobha, will you share your understanding on this case?
Sure, Anita. So, after listening to your case, what comes very striking is that there are lots of black magic and hallucinations which are seen in this case. And thus, because like the diagnosis also you said as per like it seems to be a case of a schizophrenia. And these hallucinations also, like she's seeing that, which are coming very strikingly to my mind is that the sister-in-law and her parents are like burying things around my house, like that lemon and all. Then they are feeding the non-veg to her husband, and they are plotting against her and to keep her husband and herself away. And also she's talking about the mullahs being after her and doing black magic on her as well as her daughters. And her mother, like she's getting scared that her mother will be sent to the mental hospital. And I think she also might be sent to mental hospital because the husband and the sister-in-law will try to prove her mad, So all this seems like, that they are her hallucinations. And like all these hallucinations are as if, sister-in-law is trying to injure me and my husband. That is what is coming, as if, she's persecuted, as if she's pursued, or as if the sister-in-law is plotting against her. That is what is coming. And on top of that, the husband rushes to attend sister-in-law. So there is that shade of jealousy which is coming in the mind. Also, the shade of anger towards the husband, that to an extent that she literally hates husband and there is also a revengeful attitude towards the husband, that whenever husband is coming home, she will go out and sit outside with the neighbors. So what I feel is that this case is revolving around the patient, husband, and the sister-in-law, basically. And there are definite difficulties between the husband-wife relationship. Patient feels being neglected by this husband. She also complains that her monetary and her sexual needs are remaining unsatisfied by this husband. She suspects husband having affair with this youngest sister-in-law. She seems that even jealous of the sister-in-law. And there are also aspects of some sexuality which is very clear-cutly coming in the case, that the patient feels that husband is having sexual relationship with sister-in-law. The mullah is also trying to sexually abuse her, because she gets leukorrhea, thigh pain after this thoughts or the delusions what she's getting. Her husband is also avoiding the sexual relations with the wife, and that time husband is avoiding it because of his erectile dysfunction, because of his diabetes, but she literally threatens the husband, so this is something which is not very common. And also she had affair with somebody, and she also so this tells about her sexual needs being little higher, on a higher side. So some attributes and the reactions of the patient that which I can conclude out of this is, like as husband said, that she is a selfish, dominating and stubborn type of lady who doesn't have responsibility, even though she's the eldest daughter-in-law of the family. The husband is eldest son and he takes up the responsibility, he cares for the full family. But the wife is, or our patient, she's just opposite to husband. And also the shades of anger, jealousy, suspiciousness, hatred, and the revengefulness is also seen, in the patient. Also, she's little loquacious. She goes and sits outside with the neighbors and gossips. She likes that. Also, she's a Devi Bhakta, and she believes in spiritual healers rather more than the psychiatrists. So, but what is strange is, who takes vow of not dressing up like a married woman when her husband is alive? So I felt this as a little strange thing. So to conclude my understanding of the patient, I feel that she has lots of issues of me versus you, and a comparison with the sister-in-law, the youngest sister-in-law, where she feels that she's having affair with her husband. And she also has a lot of reptile features like loquacity, anger, jealousy, suspiciousness, the hallucinations, increased sexuality. And her complaints have started because of what I feel is maybe ailments from unsatisfied sexual desires, ailments from jealousy, ailments from suspiciousness. Also, I found that she has having some delusions, like delusion being persecuted or delusion of being pursued, and delusion things are someone is plotting against her. So maybe from all these features, I'm thinking that maybe is it a reptile remedy? Not very sure, but still I'm thinking, is it Crotalus cascavella? Because Crotalus cascavella has a lot of fancies, exaltation and extrasensory perceptions in it. So Anita, yeah, I'm thinking, is it Crotalus cascavella? That is one remedy which is coming to my mind.
Good, Shobha, good understanding. Let us go to the case understanding how I understood it. Most of the points are covered by you. Can you share my PPT?
Yeah. Can you see screen?
Yeah. See, on one page, I have tried to put my understanding. See, basically, if you go to see, this patient and her husband, their relationship is very bad. They are dissatisfied with each other. Husband is dissatisfied because patient is not taking up responsibility as an eldest daughter-in-law of the family. At the same time, she has all her, suspicions and everything. Patient is dissatisfied, thinking that husband is not giving us enough money, and sexually also she is quite dissatisfied. So we see this patient as self-centered, sexually dissatisfied lady who has poor morals, because she also threatens of having sex outside and having extramarital affair. And we can think that patient also doesn't have much duty, because when mother-in-law was here for cataract surgery, she did not even visit her. For sister-in-law's sickness also, she never helped. And she also plans to go to village after the vacation is over. It is, on her whims and fancies. It is not as per, children's studies should not suffer. So this way I have tried to understand. Now, between patient and husband, they are both angry on each other, abusive, and quarrels. They even quarrel at night. About sister-in-law, she's quite young, more educated, though she's from a poor family. So there is this jealousy factor, because the husband gives more attention to sister-in-law. Though from husband's viewpoint, she is like his daughter, and he looks at her as a educated daughter-in-law who can uplift the family. Being a head of the family, he thinks of the benefit of the whole family, and he has responsibility towards family plus business. And because of this stress and lack of love and support from wife, he has developed diabetes mellitus. Now, what happens to the children? Children are both neglected because of their fights and because of their dynamics. Now, if we see, patient who has high sexual desire and she herself is thinking about others. Now, how these feelings get projected onto husband and sister-in-law. Because of her own sexual desire, she feels that husband and sister-in-law are having sex, to the extent of, accusing that sister-in-law had conceived from him, and that is why she aborted. So this is the extent of, her projections. And about God also, she feels like they are doing black magic, but I will pray my deity to, punish them also, to get even with them. So she's blaming sister-in-law and her family of injuring her by snatching away her husband. Patient and children both are deprived of love, affection, and money because sister-in-law has snatched her husband. She also, suspects black magic, and she seeks help from Baba. So these are the, from this point of view, these projections and defenses breaking. The subconscious, whatever thoughts are there, and in the subconscious, they are leaking out in the form of delusions and hallucinations. Hallucinations of being sexually assaulted or raped. And not just herself, but she feels that her daughters are also being raped. So this is the type of, hallucinations and delusions she is having. And by this, she tries to prove that she is the Devi Bhakt and she is very chaste and all that. But because of all these things, her chastity is also breaking. Next. So we will go to the repertory to understand this case. So first thing, entry rubric was dreams of rape. Because there is no rubric in the delusions about rape. So I went to dreams of rape, and jealousy, suspiciousness is there already. Then dreams of indecent behavior of men and women. Now in the follow-up, I will share that this lady used to feel that men are raping me and women are having sex with her husband. So they are both, kept away from each other. So dreams indecent behavior of men and women. Delusions persecuted. Delusion asylum she will be sent to. She says that her sister-in-law and her husband will prove that she is a mad lady and they will send her to asylum. Selfishness, duty aversion to. If we see all these rubrics, Cenchris and Lachesis are coming up, and Cenchris covers all the rubrics, whereas Lachesis is not covering these three rubrics of dreams rape, dreams of indecent behavior of men and women, and duty aversion to, because Lachesis is there in cares for the families. Next. So now if we study the remedy from complete repertory, we get all these, rubrics. Appreciation, desires, glamorous. So glamorous is something related to show off, something related to, superficial characters, and also sexual or attractive behavior. So basically, if you go to see Cenchris, the centrality is sexuality, and they try to, what is that word? Try to seduce through their sexy behavior. It is given in Materia Medica. So these people are also deceitful, sly, corrupt, and venal. It is a good remedy for politicians. Then they have this delusion of being enlarged. Enlarged is that they think that they are big. So that means they are, great. That type of thing. Megalomania type of thing. Then dreams are lascivious, voluptuous, lewd. Duty aversion to, moral affections want of, quarrelsome, scolding, jealousy from. Unfeeling, hard-hearted. Unfeeling and hard-hearted because her sister-in-law had abortion, and rather than, feeling empathetic as a lady or a woman, she, on the contrary, accuses her, Wander, desire to. Wandering is again aimless thing. So she also does, sits outside her house and talks to others. She is not, paying attention to her family. Watchfulness. She is always alert about what her sister-in-law's family is doing. They are passing by, they are peeping in the house, they are burying some things near my house. So she is keeping that watch. Then mannish habits of women. See, mannish habits of women means women are generally refined, sensitive, and they have a milder behavior. And they are very decent that way. Gracefulness is the quality of women. Whereas this lady is quite, accusive, angry, aggressive, and very sexual type of behavior also. So even this rubric can come up in this case. Then other rubrics, if we go to see, are artistic, aptitude, drawing, monster, evil, and weird things. Like drawing is not exactly drawing with pencil on paper, but you are creating a character. So now when you see this lady, she is describing her husband and her sister-in-law and her sister-in-law's family as evil. So this is what is the meaning of drawing. Then bed aversion to. She never likes to, be at her home. She tries to reject her home. She goes out and sits. Cheerfulness alternating with suspiciousness, daydreaming, death, presentiment of sudden death. All these rubrics are not there in this case, but this is the study of the overall remedy. Delusion, asylum that she will be sent to. This is definitely there in the case. Delusion, being in different places at one time. So this talks about their, hallucinations. They feel so real that they have two existences. Then dreams of animals of copulating. Animals of pursued by. Animals of pursued by males to injure her. Now, why animals? Because animals are very instinctive. They are not socially adapted. So basically, she feels everybody is so crude. Dreams asylum of insane, dreams coercion, dreams indecent behavior of men and women, dreams hurt about, dreams nakedness about, dreams rape, and dreams seem true on waking. Now this lady also on waking, she feels all the symptoms of having sex with someone. If we read it from Materia Medica, from Dr. Masters, I'm reading this pit viper in its natural habitat is extremely irritable and strikes its enemy with slightest provocation. The potentized venom has also demonstrates the above nature. Anger from interruption, disturbed averse to being. Here the central theme in the mind revolves around threat to one's own chastity. Basically, they think that they are very chaste and they are very religious, but basically their sexual instinct is only high, and that gets projected onto others that they are going to, prove a threat to my chastity, or they are going to assault me sexually. There is a constant threat from the surrounding, which makes the person extremely suspicious about the people who are around her. Delusion, people behind him, someone is persecuted, that he is pursued by wild animals, snakes, bitten by frightful nakedness, frightful dreams, then nakedness, about rape, pursued for the purpose of, threat of, and then forebodings, suspicious, mistrustful, everyone too. Censorious and death presentiment of sudden. Now this is also continuation of that. Dreams of copulating animals, dreams of indecent behavior of man and woman, fear of being bitten by snakes, aversion to domestic duties, and desire to wander. This talks of, her irresponsible behavior, her childishness or her immaturity, and her self-centeredness also. On physical level, chilliness, right-sided, intolerant of tight clothing, pulsating sensations synchronous with heartbeat, allergies in spring, and desires cold drinks. So basic sphere of action is mind and heart. And also leukorrhea and ovaries. So ovarian cyst, this is a good remedy for ovarian cyst. Now this is from Encyclopedia of Homeopathic Pharmacopoeia by Dr. Verma. Like other snake poison, it affects the system profoundly. Like arsenic, it has dyspnea, mental and physical restlessness, and thirst for small quantities of water, necessity for having clothing loose like lachesis. Marked alternation of moods, vivid dreams. Dreams are so vivid that they feel that it is happening actually to them. It's a wonderful restorative and deep acting remedy. Restorative means it will restore sick to health. Increased sexual desire in both sexes, ineffectual attempts to recline. Right ovarian region is painful. Yes, Shobha. Next. Follow-up I will take later. Stop sharing. Yes. Can we invite Kushala?
Yeah, sure.
Kushala, can you tell us how we will differentiate other snake remedies from Cenchris? Because a lot of snake remedies have very common features like suspiciousness, jealousy, aggression, sexuality, religiousness. So, and Shobha was thinking of Crotalus cascabella. So, how to differentiate these snake remedies?
Yeah, sure. I'll just share my slide. So the first remedy, as Shobha said, was Crotalus cascabella. And that's what also, her reptile features were so prominent in her. Now in Crotalus cascabella, what happens is there is a constant, that constant is very important in Crotalus cascabella, that they are feeling constant fear of some threat, of some danger, of being injured, of being pursued, of being killed. So that constancy is so much, and that too, that feeling is from a group, like a gang, like terrorists, mafia, or a group who's going to do that to them. And that group is so powerful that he cannot resist, or he doesn't have that power. That powerlessness feeling comes in him, that I don't have that in me to face that particular force. So remember, in Crotalus cascabella, the constant word is very important. So because of which he has fear of being alone, to be left alone. He has fear of being attacked when alone. There is fear of ghosts when alone in the dark. And since they have this fear of, somebody attacking, they will have constant thoughts of death when alone, and they have a lot of anger. That anger is so, there is so much of anger that they want to stab, they want to kill, they want to take revenge. But then, because they know that they do not have the power to face the opposite person, they sort of back out. But they are constantly alert and they would like to go home where he is safe. So some of the rubrics of Crotalus cascabella, which can be described, is company desire for, because there's so much of fear to be alone. Death thoughts of, alone when, fear alone of being. And there's so much about, death, death, death. So you have delusion, dead person sees relatives in room. Delusion, skeleton sees black. Delusion, skeleton sees death in the form of gigantic skeleton. Delusions, specters, ghosts, spirit sees death of as a gigantic black skeleton. Fear voices. Now there's so much of fear and, of attack that you are even, hearing voices. So that hallucination aspect you can see here also. But then that constancy is something important, and that extreme sexuality is not so much evident as in Cenchris. They are frightened easily night from indefinite things, because you're all the time, expecting some danger to take place. Clark also calls it marked hallucinations. And he sees the specter of death as a gigantic black skeleton. He hears voices to the left behind her and follows her, throws herself against the closed doors and scratches them with nails. There are thoughts, there are dwelling on death. There is fright at night about indefinite things. And Crotalus cascabella is a neurotoxin venom. The second, since so much of Crotalinae is coming in this, there is a second Crotalus horridus also, which needs to be differentiated. But in Crotalus horridus, they're very timid. They fear evil. But then whom are they fearing? The constancy is not so much in Crotalus horridus. They fear from their own family that attack will be coming from my own people, from my own family members, my own friends. So it's coming. So you have an aversion to family and friends. So they have senile dementia. They have a lot of, they forget names, they forget words, they forget places, and they're suspicious about their friends. They feel as if they're surrounded by foes or hideous animals. It's about your family, your friends, your close people. So they have a lot of antipathy to the family, and they're irritable and cross. Crotalus horridus is a hemotoxic venom. So you'll see a lot of hemorrhages, cyanosis, and gangrene. So some of the rubrics of Crotalus horridus is they feel delusions of, were surrounded by hideous faces. Delusions assemble things, swarms and crowds. Delusion, you're surrounded by enemy. Aversion to family members. So it's all about your family, your close people, and your close friends. The third remedy which comes strongly is lachesis, which comes in differentiation. Now, lachesis is an intelligent snake. For her, it's about competition, about somebody inferior and superior, that she is competing with somebody who's much more superior to her and much more powerful. So there comes the competition, comes the jealousy. So you'll see a lot of jealousy rubrics in lachesis. You'll see jealousy, brutal, kind man becoming brutal. In jealousy, they're saying and doing things what he would never say and do. And there's jealousy with sexual excitement, insane jealousy. Jealousy, quarrels, reproaches, scolds. Jealousy, driving to kill. Jealousy, foolish as it's irresistible. See, lachesis is not as immature as Cenchris is. Lachesis is intelligent. So because of this jealousy, you'll find all the time mocking, sarcasm, it's mocking, ridicule, passion too. They feel they have the delusion that they are laughed at and mocked. So then as giving back, it's like jesting, making fun of somebody. We see there's an intense need of entertainment. Lachesis is all about show, entertainment, advertisement, business. This comes because of competition, because of jealousy, because you want to be one up against a person whom you feel inferior to. So there is amusement, desire for. And they are all the time, they want to show that one up. So they are all the time talking about themselves. So you'll see a lot of ego, the very strong ego in Lachesis, speaking always about themselves in company. And this ego is shown in jealousy with loquacity. It's all about, I'm better. So you will show it in a subtle way that behind the loquacity is a jealousy. Loquacity with jesting. They are very communicative and they are loquacious. They will be changing subjects from one another. The feeling of being weak and powerless in jealousy as comparison to other strangers makes them very suspicious, and they feel that they'll be injured by those people. So you will find rubrics of injury, delusion, injury, injured as being surroundings by, delusion, injury, injured as being, delusion, injury, friends from his, that he will receive injury from his friends, delusion that he is about to be poisoned, that there are conspiracies against him. There's a strong fear of being injured, attacked, and danger. So you will see that Lachesis, being so intelligent, will never reveal his true nature. They are so hidden, so well camouflaged, so concealed, that you'll see a duality and deceitful. It's one of the most deceitful and sly snake. So they are good in feigning sick. You'll find a lot of manipulative rubrics, deceitful rubrics. Other characteristic rubrics or important characteristics of Lachesis are they have a lot of forsaken feeling. They feel delusion, deserted, forsaken, and they have strong pitch. So their extrasensory perceptions are very strong. So you will see clairvoyance in it. There's a heightened sensitivity to touch or to surface of the body. So you can see that they can't bear anything tight around their neck or their chest. And Lachesis has parental care, which was not so in Cenchris. She was very indifferent to her duties and to her children. And it's left-sided, from going from left to right. So these were the three, reptiles which came very strongly as a differentiation in her case.
Very nice, Kushala.
Yeah.
Aditi, can you differentiate other remedies which come close in this case? Please unmute yourself.
Yeah. See, when we are listening to this case and analysis, the closest we are feeling the remedies coming is hyoscyamus and even stramonium. Now we know both these remedies are from the plant kingdom, and also they both are from the same Solanaceae family. Now, if we see Solanaceae family is falling in the vegetable plant kingdom column 6 and row 1. Now, both these remedies have these features, these special features of both have this me versus the group. And that is why we are feeling this coming close to these snake remedies. They have strong ego. They have these emotions versus rationalism, and then status, positions, pleasure, sex, this fighting to survive, struggle of masculine and femininity. As it is falling in the column 6, it is very masculine. But since it is in the row 1, there is slightly that pre-life and unpreparedness, and they are connected to another world, and there's death and fear to be born, and these connections with shamans and black magic, ghost, religiousness, and so on. Now, if we see basically again, now if we see Solanaceae, which is called mainly nightshades. Now, when we say nightshades, so they're so prominently, especially in stramonium, there is tremendous fear of dark, and they always desire for sunlight and sunshine. So this stramonium, especially if we see, there is a lot of this fear of darkness and this unpreparedness to face this world. They are very childish. They are very clingy. So this also, there is a uncontrolled intense emotions are seen. when stramonium, when they are angered, or we see like they have to be chained and all. There is so much of violence in their anger and all. So, and they are very clingy. And this remedy, when we see this remedy, it is always, when there is some kind of abandonment, because they always want to cling. So when they see some kind of abandonment, then there is some kind of disappointments, frights, trauma. These type of causes these maladies to come in the picture. And they are very clingy to money, partner, and even anybody. Like if they are thinking guru or somebody, they are very clingy to them. Then this so there's fear of darkness and desire for light. And when stramonium falls sick with all these causes, generally we see lot of spasms coming up, chorias and twitchings and jerkings and severe cramps and colitis and pains, crampy pains. And we see a severe anger, rage, kill desire to setting things on fire, breaking, kicking, striking. Such things we see when we see stramonium pathology. And there is a kind of paralysis and stammerings and all those things. And they have like religious mania, which we see in this lady also. But this lady, as explained by Kushala and Anita, that here it is at a different level, whereas in stramonium it is a clinging towards the religiousness also. Now, if we differentiate it from hyoscyamus, then again, see, basically hyoscyamus is also falling in the same six subclass, and this row one only. So they are very initially they are very naive and childish and very playful and jovial and that type of personality. But again, see, there in hyoscyamus, the main thing is fear of betrayal and jealousy. That is why we see many a times hyoscyamus coming when a second child is born in the family, because then they feel that position is threatened. Then that betrayal feeling starts coming, that now their position is threatened, and so this disappointed love will come again here, and they get frightened because of this feeling of betrayal. And also they also have this poor impulse control. And when we see poor impulse control in hyoscyamus, they go more into this sexuality and lewd talks and like inhibitions and moralities and masturbations and nakedness, shamelessness, and this type of exhibits we see in hyoscyamus. So basically, here in this case, because of the knowledge of kingdom, I feel it is easier to differentiate and come to the animal kingdom in a much faster and better way and with clarity because of the kingdom differentiation. And other things, if we see in hyoscyamus, like when Anita was showing the rubrics and all, so I saw that this deceitfulness and the kind of deceitfulness and slyness of the snake is not there in hyoscyamus. That rubric is not shown in hyoscyamus. Then also this this very peculiar thing I felt was, of course this is my understanding, I felt that basically it is a sixth column, so it is very masculine. And here this lady is talking about shringar and all those things. Now hyoscyamus, stramonium, less talk about all these things. They don't talk about these things much. And because they are very masculinity, and femininity is almost suppressed now by the time they reach to this sixth column. And that is why even when we see the rubrics, all the rubrics are mentioned with wife, delusion, jealousy, everything with wife, because they have a strong masculinity in them. And that is what I feel, that is how I can think of differentiating hyoscyamus and strammonia. Yes, anybody wants to add anything to this
I
understanding?
think it will become more clear when Nirupama shares PEM understanding.
Yes.
So
Yes,
next will be Nirupama. Nirupama, you can share PEM understanding of schizophrenia as well as the remedies.
Yes, sure, Anita. So basically, Cenchris is a chili snake. That is what we all know. So, what is schizophrenia? Schizophrenia is person who lives his inner world. See, we all have inner world and the outer world. Ego starts developing from the second year of the age, and it starts controlling the inner needs of the person. And what we project is a socially accepted behavior. But what happens is in schizophrenia, your inner identity, your inner needs become so strong that ego is no longer able to control it. And then ego breaks down. It becomes weak, and your inner identity becomes very strong. It's open. You can see what person as it is. So there is no more social mask now. So, see, these cases are very open and clear cases for us. Otherwise, in other cases, we have to probe. Like there is such a of ego that we have to really go inside and find out what is the inner reality of the person, and it becomes very difficult. But schizophrenia, it's an open case for you. You don't need a lot of probing. So it's very easy to treat for us homeopaths. So there is a free expression without any filters, and there is a confusion between inner reality and outer reality. So what happens in Cenchris? Cenchris is basically a very child in Crotaline family. It belongs to infancy level of development. What is infancy? Infancy where you are working with the pleasure principle. It's Eid. It's oral stage where you are working with the pleasure principles. And in Cenchris, you see lot of attention to the sexual pleasures. This patient also, if you see, she was experiencing the sexual act. In hallucination, she was literally experiencing it, and then she was saying it was so dirty. So dirty is also a very big theme of snakes. They have a lot of sexual desire, but they feel it's dirty, and that's why it's projected on others. And all these sexual needs are in Cenchris, if you see it. So it is expressed in dreams. Where dreams are very characteristic in Cenchris, where a lot of sexuality and rape theme is coming. And because it is snake, it is usually projected on someone else. As in this case, we see it is projected on husband, sister-in-law. And very important in Cenchris is to look good. Appearance is so important. To look good is so important in Cenchris that it is called as sexual seduction. They seduce the partners to their sexual acts. That's why appearance is very important. And so how this lady is saying, I stopped the shringar. मैं अब कुछ नहीं करूंगी. That is what is the level of the development. Typical snake theme is of material versus spiritual. All issues, if you see in this case, is sexuality and money. There is no other theme has come up. Sexuality, where she feels husband is not providing her. Husband then goes out, he's cheating on her. Lot of money theme has come. Husband doesn't provide money properly. Then money was stolen by someone. And then what is the solution? Where is she going for the solution? She goes to the spiritual healers. She goes out. See, spirituality again. And in that, what is the solution is black magic. Black magic. Spirituality is the connection with the other world. All snakes have connection with the other world. That is womb stage of development. Why it is called as other world? Because we are not aware about it. We don't know. It is black. We don't know about it. That's why it is called as other world. And that's why they have a lot of relationship with their night activities. What is night again, if you see? Night activities which are unknown, which are wrong, which are sexual. So they have a lot of connection with this. And when it comes to Cenchris, it is purely comes to sex. That is what is there, the inner identity. It is at the level of that oral personality. So the whole personality, if you see, revolves around me and my sexual needs. There is no further development. If you see, other snakes are quite intellectual. They have developed ahead. But Cenchris has remained at this level, at level of his own needs. And that's why if you see, this patient also is not aware about her own children's need. She's not aware about her husband's need. She's only entangled in her own needs. And that's why she's suffering so badly. And that is the whole understanding about the Cenchris as per me. Anita, you want to share follow?
Anybody wants to?
For that, I will just share one small thing by Dr. Annette. I had watched one video. In that, she has given how snakes seduce. Last time, I think Nirupama also had mentioned that Naja seduces by doing her duties. So she has said that Elaps and Naja being nice, soft and creative. Crotellus horridus, look how good I take care of the family. I remember your
Yes.
case in which that lady
Oh,
used to
no.
take care of her sister-in-law. But in
Yes.
her care, like she was very suffocative. She was very dominating, like way she wanted to take her care. I think one day we will share that case also.
That is also.
Crotellus cascavella, look how clairvoyant I am. So I wanted to add one point about Crotellus cascavella is their extrasensory perception is very, very, very acute. Plus, they have this connection with ancestors also. So they are more spiritual. They are not that sexual, but they are more spiritually evolved and they want to be spiritually evolved. So for them, it is more of, connection with other world is not that frightening, but it is more out of their curiosity and inquisitiveness and extrasensory perception. Then Cenchris is by look how sexy I am. Bothrops is look how powerful I am. Vipera is look how good I take care of the house. And Lachesis is look how intelligent I am. Her Dr. Annette's video is there on YouTube. I think you can all watch that. We will go to follow up. Anybody wants to add anything about the remedies?
Anita, just to add to what you said, no, like what Dr. Vijayakar sir has said in his book, he has written is, he has described Lachesis as a witty snake, Naja being a sad snake, Cenchris being a sexy snake, Crotellus cascavella is a spiritual snake, Crotellus horridus being an angry snake. So that is again another thing, way in which it can be differentiated.
Yes.
Also, like, I entered Cascavella thinking that it is from the hallucinations mainly, So possibly that was again the feature of the schizophrenia. And that is how they are the disease symptoms. So what we should give importance is the individualization symptoms and what is, as an individual, what is coming up more in this patient. So that was the sexual sphere was more prominent. And that is why that should have been given more importance rather than the hallucinations. And that is how you can then reach to the Cenchris and not Cascavella.
Okay. Excuse me, I'll have to get my charger.
Yeah.
What hallucinations are there? That is also important, Shobha. If you see the whole Cenchris today's case, the hallucination is all about sex.
Yes.
Husband is having sexual relationship with someone. So what comes in hallucination? That is very, very important. Every snake will have different hallucination, and that will characteristically belongs to that particular snake.
Right, right.
And one more thing I want to clarify is extrasensory perception is different from delusions and hallucinations. Extrasensory perception is more of acute clairvoyance, where their senses are so heightened that they can, predict things before that they happen.
Because of that extrasensory, that's because of the pits that they have, the crotalinae, the pits. So they can, even sense and smell a prey at a distance, by which they can capture the prey. That is what brings about the extrasensory perceptions, as well as leading to clairvoyance.
Okay.
Yes.
Let's go to the follow-up. Shobha, can you share the slide?
Yes.
Patient had been there with me on and off, but on 1st February 23, that is, it is a very recent case, I came to Cenchris because of the totality, which I have shared already in the life space of the patient before. But on that particular day, what information she gave, I will focus on that. So on first, she came with nervousness, hallucinations, and saying 7 to 8 Muslim men naked and they are raping me, and a lady is preventing me from going close to my husband. Children are irritating, keep fighting, no desire to work, left arm itching, and she had black spots on her forearm. Nobody talks to me. They dance on her tunes, that is sister-in-law's tunes. Lady should keep family together. If you break, Lakshmi ji will be angry. And husband does not give money. I do odd jobs. I can make out from face what dirty job he has done. So whenever he used to come home tired in the evening and take bath, she would feel that he has done something wrong. And because of that, he is taking bath. So this was a picture on 1st February 23. And on that day, I concluded Cenchris. So on that particular day, I gave him Cenchris 203 doses. I did not have one impotency, and I gave 3 doses because she was sounding quite, morbid. So her disease state was quite prominent. So I thought of giving 3 doses. Then again, she went to Baba's and all that. So she did not come to me again for almost 1.5 months. So on 13th March, again with same complaint, she came that they have done dirty job and I have pain in thighs, leukorrhea, weeping. She was weeping and she was not getting sleep. In spite of taking sedatives, they had gone to a GP and took sedatives from him, but she was not getting sleep after taking sedatives also. And she also had fear of going to that room. So she decided to go to her other sister-in-law's house and sleep with her. So, and that fear of they will send me to asylum was also quite prominent. So again, I gave her 1 dose stat because she had come to me in the morning, and 3 doses HS on the 3 consecutive days. So after that, she was much better. On 20th March, thoughts were better. She said, my children are also improving, and husband is still under their influence because I don't know how much they had fed him. And she was cursing her sister-in-law. So that time I gave her Cenchris 1M single dose. On 7th April, she was much better. Thoughts were better. Slowly, their influence is reducing. She said, their influence now is reducing. They are falling weak and I am now, able to overcome their influence. And now nothing happens. Now she did not complain of any rape or any thighs pain and all that, though weakness was there. And she had started getting cough, which was rattling. So I've seen in many psychiatric cases when the mind is improving, physical ailments come up. So it is coming from, a more important part of the body to the lesser important body part. So it was a very good response in my judgment. So I repeated 1 more dose. Then on 15th April, her weakness was better, her sleep was normal, cough was better, and she had passed one blood clot from her mouth. They had sent a picture, and she felt that whatever they had fed her for black magic, that had come out in the form of that blood clot. So after that, she felt much better. How to explain that, I don't understand, because she did not have any respiratory pathology, but she did click a picture and send me a picture of blood clot. Now she likes to wear good things. And her sister-in-law had fracture. She is also pregnant again, second time. But this lady felt, vindicated, like she is suffering now. She is having fracture and I am improving. So now they are defeated, and she believed that tomorrow everything will be over, and she will, her distance between her husband and herself also will get over. So this was the good response. And just yesterday, her husband had to come, and patient had not come. She talked to me and on phone, and she said she is feeling much better and she wanted same medicine. So this is the follow-up. And I was really happy that she responded very fast. So this indicates that if you strike a simillimum, response is really good, in spite of a pathology like schizophrenia also. Anybody wants to comment or say anything?
So, anyone wants to add anything? Otherwise, so friends, hope you will definitely enjoy and much get benefited by this our session, and continue watching our sessions. You will learn more and more and in-depth studies of all the remedies and all the different cases. And sure, all your suggestions and your queries are welcome. We will try and definitely answer those queries.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you very much.
Thank you.